Hi there. Look, just wanted to do a quick video shoot for you here to let you know about some great questions that Tracy Ann Smith has sent to me, which is going to be provide some great details for everyone involved in the manual therapy side of looking after foot and leg problems. So what Tracy has asked is she's got a mum who is orthotic free for the first time in 12 years thanks to FMT, etc. However, the question is minimum age treatment for kids. Now, first of all, great. Imagine being limited with orthotic devices and footwear to now be able to have freedom of choice with footwear. That's the scope, that's what FMT can actually do for you. So well done, Tracy, for getting that result for that particular mum. Okay, so when we're dealing with kids and minimum ages, remember that the primary objective of FMT is to actually release connective tissue restrictions that interfere with normal joint function. And so you're wanting to determine, is a joint's quality or range of motion limited, and then we work on releasing those connective tissue restrictions. With growing bodies, the range of motion typically is higher than what they would normally be compared to an adult. And it's pretty rare that they have tissue restrictions that are interfering with joint function. So normally with kids, and when we're talking kids, it's like pre-growing stage, before the bones have actually fused. So that's typically 12, 13 or so with females, and maybe 13 or 14 with males. That's typically when we would adopt an FMT treatment plan that released connective tissue restrictions that had formed as a result of compensation for biomechanical anomalies. What happens with kids though is that because of their flexibility and extreme actions that they can do as far as accidents, events, and jumping off the garage roof in their Superman cape, bringing up some of my old activities of course, you can get a build-up of hydraulic tension within joints because of abnormal or excessive forces. So this is when typically the patients and the kids will complain, where does it hurt? Well, it feels like it just needs a good crack. And that's because of the hydraulic tension in the joints, putting pressure on the proprioceptors, giving that feeling of, it just needs a good crack. So we, in that situation, will typically use one of our, what we love to call our one-hit wonders. And so these are manipulative techniques that will be focused on the specific joint that is tight, restricted, or limited to release that hydraulic tension. And normally, straight after one of those releases, the patient will go, yeah, okay, now that feels like it moves normally. So in our FMT intensives, we spend over half a day really focusing on the range of techniques that we use for our one-hit wonders, because they are just so useful for biomechanical cases. So keep that in mind if you wanted to build your skills of manipulative techniques for specific joint restrictions. The one-hit wonders are an excellent tool to become masters at. Okay, then the other question, I'm seeing a teenage VFL footballer. VFL, for those of you in the Northern Hemisphere, is real football. And with medial sesamoiditis, and has been to every specialist under the sun, doesn't want surgery or cortisone. Any suggestions would be appreciated. Sesamoids. Now, sesamoiditis happens when the sesamoid bones literally don't sit in their grooves correctly. The way I'll describe it to patients is that sesamoids need to sit in these grooves, and if something happens that forces them to shift or displace, you get that bone-on-bone edge, that feeling of bone bruising, but that shift happens because of the biomechanical integrity has been lost, and the first MP joint, the body's launch pad, has been, it's compensating for some reason. So whenever we get a sesamoiditis case, the first bone that we will look at is the talus, because so often you'll see the talus shift anteriorly, and you get the domino effect of pushing into the navicular, into the cuneiform, into the metatarsal. And when you get that cascading effect, it then overloads the sesamoids. And if you've got an unstable first MP joint when the body is propelling, the whole sesamoid apparatus just gets pushed. And typically it'll be pushed laterally. This is also the case with HAV, where you get the deviation of the big toe, sesamoid apparatus will push across laterally. So you get a tightening of the tissues on the lateral side of the sesamoid apparatus, but you'll feel the symptoms, just as Tracy described here, on the medial sesamoid. So what we will always do is work on resetting the talus posteriorly, and then work the navicular, cuneiforms, metatarsals posteriorly. So that whole medial beam has got to be reset back posteriorly to take the tension off the sesamoid apparatus. Now, once you get this, so as we're working on those areas, then we'll focus on the sesamoids. The technique we'll use is literally get your thumbs onto the lateral sesamoid, grab there and then hold and stretch 2, 3, release, and then hold and stretch 2, 3, release, and repeat that 3 to 6 times. Now typically what you're doing is the tension that's building up on the lateral side of the lateral sesamoid, that's the tissue that needs to be released to allow the sesamoid apparatus to shift medially again. So crucial step though is to make sure you identify the talus and reset the talus, because if you don't do that, this will give temporary relief at best. Then we would, while getting through the acute phase, although in Tracy's case it's been going on for a couple of years, so we've got a chronic condition here, it's going to need some fairly deep releasing work. Doing some wing padding here to keep the pressure off there with some compressed felt to take the load on 2, 3 to 4 and 5 to give this area here under the first MP joint a bit of a break. I think that's the connective tissue restriction. So yeah, take care of the talus, the whole medial beam, and then get a more effective result happening with the sesamoids. So hopefully that's given you some clues on how to deal with some tricky cases, and until next time, keep your questions coming in. We'd love to be able to help. So hope your day goes absolutely bonza, and in the meantime, stay healthy, wealthy, and wise.